Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Delighted to be back with you this morning. And wow, do we have just the best people here with us today. We're going to have a really fun time this morning. It's going to be a great program. We're glad you're with us. We're broadcasting live from the Dulles Simons Family Studio. Before I get into all the guests, first thing I'm going to do, though, is turn to Hawk. What do we got today?
We are at that plateau. Not a low plateau, not as high a plateau as we have seen, but we're kind of in that range. Certainly would like less patients. 117 total patients in the hospital, with 69 of those being those acute or active infection. 21 of those 69 in the ICU, so a lower proportion, which is good. And then 10 of those in the ICU are on the ventilator, so half of those in the ICU need to be on the ventilator. We still have 48 in that recovery period, with 3 remaining on the vent for that long duration as well. And Hayes is doing okay as well. Their numbers are stable. They've reached a plateau as well so far. 22 patients, with 18 of those active and 4 in that recovery period.
Just want to say it's good to be where we are. It'd be a lot better if it could be lower. The way we can be lower is if you continue to follow the rules of infection prevention and control. Hey, our guests today include KCK Mayor and Chief Executive Officer of the Unified Government, David Alvey. We're delighted to have you back today. Thank you for being here, sir. Chief Medical Officer for the Public Health Department for Wyandotte County, Dr. Alan Greiner, and Professor Jason Glenn from the KUMC Department of History and the Philosophy of Medicine. And we are going to talk about vaccines, the infection rate in Wyandotte County, how we get vaccines into arms, how to slow the infection rate down. So that's a big conversation. Thanks for being with us. So first, I'm going to turn to you, Mayor Alvey. The hot question of the day, why did Wyandotte start to back off on restrictions? What changed?
So I think the approach has been the same throughout, and that is we always have allowed our public health department, our chief medical officers to gather the data, to examine the data, to show us what the trends are. And we were looking locally, nationally, internationally to see what the virus is, how does it spread, what mitigation measures work, and then we would enforce those. And so we've been supportive of what our public health department has led us throughout this whole pandemic. And so it's been a constant gathering of information and data and analyzing that to see what the trends are. And at the same time as we've brought the mitigation measures, we have tried to maintain as much normal activity as possible, because we know obviously that's what we want to do. We want to be as normal as possible and yet be as careful as possible. And so I would say that over the past 9-10 months, 10 months now, we've erred on the side of caution. And I tell people that's what we should expect our public health department to do, that when the data shows something, we're going to be a little extra cautious because there's so much at stake in lives and livelihoods. So what we've saw, and I think Dr. Greiner can speak to this, is when you looked at the data over the past several weeks, we saw that there were other mitigation measures, specifically the gathering limit size, the size of the gatherings that those were much more effective in limiting the spread. And at the same time, we looked at how our bars and restaurants were implementing mitigation measures, and I personally visited a couple of sites to see what they had done, and were able to tell that, in fact, I would feel safe going into this establishment. And so that was really the genesis behind this, that, again, look at the data, bring whatever mitigation measures are necessary, but then at the same time, when a relaxation is warranted, to go ahead and do that, because, again, we are trying to care for public health, but also care for everything else that we do.
Yeah, that makes sense to me. And, we have to act justly, right? Because we have to find in our very difficult society justice. And justice can be found, I think, through science and truth and the exploration that y'all have done. And it feels like we have been able to open up several things successfully. And I think Arrowhead Stadium has been an example of success. I think KU Lawrence campus has been an example of success. So you can open up if you do it well and do it right. And I'm just going to do a quick turnabout and go to Alan Greiner. Alan, you're convinced we've done it right.
Well, I don't know if I'm always convinced we've done it right. I think we've second-guessed ourselves sometimes through this pandemic, but public health is about balance, and Dr. Glenn's our expert on this, because the history of public health is convoluted, and there's been other pandemics and there's been other things where we really had to balance individual freedoms and collective safety with each other, and people's rights sometimes get trampled on. And there's been there's been suggestion that that's gone on with this pandemic, but I think we've really tried hard to factor in different things as we go along. And so, you know, one of the things we saw, and I don't know if you guys have talked about it on the show before, but I think in Kansas, we all thought we were going to have a major post-Thanksgiving bump in cases around here. And in Wyandotte County, we really didn't see that. And there's been some suggestion that some of the areas of the country that were just really scared in November, like North Dakota, South Dakota, Iowa, Kansas, we had people changing their behavior over the Thanksgiving holiday, or we really would have seen a major bump. And we weren't seeing clusters of cases out of drinking establishments or restaurants that serve beverages. And so we just felt like making this change, and we don't have a whole bunch of bars and restaurants in Wyandotte County, honestly, compared to some of the other counties around us. And we were trying to get alignment with Leavenworth, with Johnson County, and just make it fair. So it's that balance with rights and public responsibility that's always a battle. And we'll change again. If we have to change again, if we have to admit we're wrong, we'll change again.
Dr. Glenn, I want to come back to the point that Al just made. There is this consideration about how we have to keep everybody healthy through a crisis like this. And it's certainly the rules of infection control. You guys have heard us preach about that 1,000 times if you've heard it one time. So we know how important those are. But talk to us a little bit about how we could do justice in the county during the time of this COVID pandemic.
Well, what we can really do is try to, we have to try to achieve a balance in our prioritization schemas between folks who are at high vulnerability for infection, folks who have high vulnerability for mortality, and folks who work in sectors that have high vulnerability if those sectors go down for really, our society not functioning properly. And, that's a really hard, triad to balance in terms of all those things, right? The federal guidelines have tried to balance more on people who have high risk of infection and who work in industries that are critical. And what we're trying to see if, there's room to also make sure that we can get those who have or those who are at highest risk of mortality if they catch the disease. That's been very difficult to balance.
It is a balance, isn't it? Mayor, one of the things we've known, we've been concerned about is that the late people stay out, the more they drink, the less barriers they have, and the less they follow the rules of infection prevention and control. How will you account for that, and how will you guard against it?
Right. So I think what again, because I visited some sites and I talked with bar owners, and when they've described to me the mitigation measures that they are enforcing in their own establishments. And so when we were looking at perhaps relaxing this particular restriction and staying open until midnight, we gathered together and reached out, my staff and we reached out to the bar and restaurant owners in Wyandotte County, Kansas City, Kansas, and we gathered them together in a very large call last week to say, describe for us your best practices, what are you doing? But we're saying that we need your commitment to continue to have these mitigation measures, that you need to make sure that you're enforcing these things. If we're going to reopen, we have to be assured that that's going to continue, and that if there are some bars and restaurants who are not really compliant, we do have health inspectors who will go out there and we will enforce the order as it's written. So I think what happened is we really took an approach, let's work with the bar and restaurant owners to make sure that they understand what is necessary. They did. They've already begun taking those steps. They're monitoring, they're enforcing, because they do not want to be known as a source of spread. They want to protect their employees. They want to protect their patrons and their loved ones. And so what's interesting to me is, as we move through the pandemic, the very thing that we continue here when people push back on the mitigation measures, the mask wearing, whatever, is, well, you're taking away my personal responsibility. Well, no, in fact, we are requiring even more of your personal responsibility. That the bar and restaurant owners, as we move through this, have become much more aware and concerned, and so they have taken more responsibility on, and that's why they reached out to me and say, come and look and see what we're doing. And having done that, I felt very confident in that. So there may be some outliers, people who will not comply. We will enforce because we have to. So, and that actually, for the majority of the bar and restaurant owners, collectively, they do not want to be known as a source of spread. So the peer pressure among that group, I think, is going to move even people who are non-compliant to say, we better get compliant because this could be at risk. Again, if it does become a significant source of spread, and the data suggests that, I'm confident that our chief medical officer will come back with other recommendations, which we will support, again, to stop the spread. But insofar as bar and restaurant owners and business owners understand their responsibility to protect themselves, their loved ones, and their customers, and do the proper mitigation measures, we can continue to relax.
Yeah, I think that is so well said. Thank you.
Yeah.
And thanks for your leadership and your whole team's leadership in Wyandotte County. I mean, one of the things I'm struck by is Wyandotte County is one of the most diverse places in the United States, right? I mean, really, you look at it, it's just one of the most diverse places in the United States. It feels more like a family today than it felt before the crisis. And as I look across our metropolitan area, across the country, I'm impressed by what a feeling of family Wyandotte County has. And you guys have done that. Good job.
Well, we fight enough, so there you go. That qualifies as a family.
That makes you a family.
Yeah.
That's awesome. All right. So how are the vaccinations? Man, I can't believe I can't say that word. Vaccinations going. I know. I don't need coffee. I get too wired. Vaccinations going in Wyandotte County, Alan Greiner.
Really great. We've almost vaccinated all of the community healthcare workers that we've been able to identify. We've been out there beating the bushes trying to find every small dentist office and chiropractic office and everything we can to get people vaccinated, and we think we've got them all covered. We really appreciate what the health system here has done to cover the huge workforce on campus here, as well as probably some additional folks that are attached. Now, Johnson County is a little bit behind. We've heard some numbers in terms of them just not having enough vaccine down there. So I believe we're all trying to share. We've actually vaccinated at our max vaccination site some Johnson County healthcare workers as well. We've tried to pitch in there, and I think the health systems has pitched some vaccine in, and I think the state's working on it as well. We've actually got the governor coming to visit our site today. We want to show it off, and we think we can do about the same number that I've heard that the health system here is going to potentially be able to do in a day. We think we'll eventually be able to do about 2,000 a day at the Kmart site at 78th and State. We've got a website link now in Wyandotte County where people can go to our website at wicokck.org and say they're just interested in getting the vaccine, and they can enter some information about age, conditions, and we're going to start working off that and open additional sites as soon as we have more vaccine too.
Yeah, and congratulations. You guys have done great work. And the best part about it is people are sharing back and forth, whether it's Vibrant, Wyandotte County, the health system, Johnson County. We're trying to work together to make sure we keep people safe. Because, Mayor, that's what's going to help our businesses. That's what's going to reopen us up.
Absolutely. I mean, we have so many tools to fight this common enemy, and if we all understand that each tool has its place, let's implement every single thing we can, follow every mitigation measure, we can really knock this down.
Yeah, it can really make a difference. Okay, so let's talk for a moment about vaccine hesitancy. That's for all of us. We know that's where, even on our own campus, we're vaccinating about 60 to 65% of people. That means we got 35 to 40% of people turning it down. So, Alan, what are you seeing in the community, and how are you guys handling vaccine hesitancy?
So we're seeing similar things. I think we've seen a little bit of a shift since the early fall. When I think we with national surveys saw about 50% pretty hesitant. So it's shifted a little bit, and hopefully will shift more. I was on a panel last night with some local church folks and a whole bunch of community members, as well as Dr. Castro here from our campus that's involved with the AstraZeneca vaccine trial, trying to talk up safety. 10,000 healthcare workers have now, or 10 million healthcare workers have now been vaccinated across the United States. That's a lot of data on safety. We're going to have a ton of data on efficacy, but of course we already have the efficacy data from the trials with 40 and 30,000 people in those. So I think we're going to be able to reassure people that this is safe and the right thing to do, and we get more shift. We've got to get more shift. We've got to get those numbers up even higher than 60, 65%.
Yeah, totally. So, Dr. Glenn, how are we going to do that? I mean, you've had a lot of experience in this type of an area with your research and your work. Mm-hmm. You often teach medical students about the how and why around science and medicine and cultural differences. Man, what can we do with COVID-19? How can we get to some of these health inequities and maybe a history, well, not maybe, and also a history of a lack of justice in medicine and science?
Thanks for that. Unfortunately, there are many communities that have, historical reasons to be mistrustful of the biomedical industry, from histories of exploitation and abuse in medical experimentation, and all the enduring health inequities that communities of color tend to suffer from across the board in all different areas. And those health inequities can't be reduced to differences in education or class or geographic area or genetics. They really come down to, the personal decisions of care that get made in a clinical setting. And, combined with, that history is all the misinformation that circulates in our age, right? That so many people rely on various social media platforms to get information about what's happening in the world. And that information is often not just not credible, but, intentionally misleading. And that makes for just, a time bomb as far as, how people perceive the vaccine. So there's already been so much misinformation about vaccines combined with historical reasons why communities might mistrust the medical profession. So that's why it's extra important for us to be out here talking about the vaccine as much as possible, about the safety, about how the trials were conducted, and about any potential side effects, being honest about them so we can give people the best information possible, and being honest about, those reasons why some communities might be mistrustful, not skirting around that issue, being very direct, saying, yes, there was this misconduct in the past, but, here's what's happening now. And when we look at what's going on, one of the advantages we have is because of the way that the government, recommendations around tiering access is that, a lot of affluent folks got the vaccine first. And so we can look at how they're doing, and we can see that they're okay, and we can know that we'll likely be okay as well.
Yeah, that makes total sense. And I think that we do have to continue to try to reach out to people, because that effort has to be a couple of things. First of all, it has to be just. It has to be educational. It has to be compassionate. And it has to be truthful. And I think if we can stay on that message slowly, we can win hearts of people who may feel disenfranchised right now for a variety of reasons, Mayor.
Yeah, that's absolutely true. And I think also there's, unfortunately, the pandemic has really revealed a lot of the stress fractures, I think, in the body politic. And I think the comment that, the misinformation campaigns, those things out there, it's really what I've experienced just in general is people do not feel close to the centers of power. They don't feel close to their elected leaders. And so I think that's partly the rise of populism, whether from the left or the right. And that's a fairly large chasm to bridge. And I think it's showing up now in the vaccine as well. People don't feel confident that what those who are developing the vaccine, they're going to say, well, they're making money off of it. There was some conspiracy there. And in fact, let's just deal with the facts. The vaccine, the virus is the virus. One of the best ways to stop it is to get, in fact, the best way is to get the vaccine so that it doesn't not have a host to spread to.
Yeah, it is very true. And Hawkeye, we know that the vaccination ultimately is what's going to help us get back to normal.
Yeah, absolutely. We know that these new vaccines, Moderna and Pfizer, but hopefully Johnson & Johnson and AstraZeneca, that will all help, because I think the major drawback right now is the supply of vaccine. And we know that if we can protect individuals from having severe disease and critical disease, and that's what these vaccines have been shown to do, then everybody is much better off.
All right. Well, here there may be a few reporters on our line, so let's get to their questions. Who's out? Who wants to go first?
All right. Good morning, Cody Holyoke, KMBC 9 News.
Cody, good morning.
Hey guys. So When we talk about Wyandotte County, I know that the doctor just said that they've almost vaccinated all of the community healthcare workers that you can identify. I know Dr. Norman earlier this week was talking about counties helping counties. I'm curious, will Wyandotte County move forward into a new phase, or do you work to help the other counties first until KDHE says, okay, it's time to move forward?
All right, great question. Let me first, I think Alan's probably best equipped to handle that, and then the mayor.
Yeah, great question, Tony. So the current guidance we have from KDHE at the state level is that each county, or all the counties need to finish the first phase before we can move to the second phase. That could change. I know that the state's discussing possibilities there. We're certainly in Wyandotte County, we're committed to helping because we know that everybody's health is connected to everybody's else's, especially in a pandemic like this. So that's why I said earlier, we're doing vaccination of some Johnson County healthcare workers. We're doing people that live in other counties but do a little bit of healthcare work, like home health, for example, in Wyandotte County. So we're trying to throw in as much as we can. We will move forward if we're allowed to move forward and if we have supply. But as Hawkeye said, the supply issues I think are going to be a big issue in the coming weeks that we've all got to face too. So I think we'll continue to have to find ways to cooperate county to county and across the state.
Yes, I think Dr. Greiner said it well. I just want to add one little piece. There's been some concern that if you get the first round of vaccinations and we'd have a problem with a supply, would you be able to get the booster shot? And in fact, I want to be clear that that is already reserved. So if you come in and get your first shot, that second shot is already reserved for you.
Yeah, I think that's been our approach. Now, Alan, there's discussion on Hawkeye. There's been discussion about opening it up and just everybody getting their first dose, and then you'll get your second dose whenever it's available, et cetera. What do you guys think about that? And would that be something the county would consider or that we should consider?
I don't know. I'd be interested in Hawkeye's opinion on that. I think we need a little science behind that. You know, I think we heard Joe Biden talk about potentially when he's inaugurated that he might release all the initial doses, but it sure would be nice to know what people's immune response to that first dose is and how much protection they get from one dose, because if you get minimal protection and you really need that second dose, I'd like to see that data, and we may have it, right? We vaccinated millions of people. So any thoughts on that, Dana?
Yeah, absolutely. You know, I think, the initial studies did show you do have somewhat of a response, or individuals will have a response. But my concern is not that you would get the second dose, say 2 or 3 or 4 weeks after your scheduled time if there is a backlog in the supply. My big concern is that people won't get that second dose. They won't come back for that second dose. So I think that is more important than if that second dose is delayed by a few weeks while the supply gets ramped back up. Because individually, we know you get one shot, you think you're okay, you haven't been sick, you're just going to kind of forget about it. People do, they go about their lives. And so I think my biggest concern is that individuals will just not get that second dose. I think it's okay if that's done, where you are trying to, theoretically get more people vaccinated, but my biggest concern is that people will not come back and get their second dose. Mm-hmm.
All right, let's see if there's another question from one of our reporters.
Hi, Kara Mashik with Fox 4 here. Good morning to you all.
Good morning.
Wanted to ask, I know you guys have talked a little bit about this before, but in terms of some of the more severe reactions that some people are having to the vaccine, kind of the unusualness of that, if you have seen much of it as you've been vaccinating folks within the health system and within the county. And second to that, I know that there's the kind of 10 to 15 minute window after someone is vaccinated that you kind of keep an eye on them. Can you talk a little about what exactly you're looking for and what would sort of trigger you to feel like, oh my goodness, this person needs a little bit more attention?
You bet. So, Hawkeye, we've given over 7,000 doses of vaccine here in the health system, and I have to say, we really haven't seen a severe allergic reaction. We've seen some reactions, but this vaccine is safe.
Yeah, absolutely. We have seen those well-documented reactions, especially at the site, so at your shoulder, of the pain, maybe some fever, chills, or fatigue in the next couple days. But just to your point, we haven't seen those severe, the anaphylaxis reactions or the severe allergic reactions. We've been pretty lucky like that. We do have people who are on standby to evaluate as soon as you get your injection. We've had a couple people who, have felt dizzy or had to lay down or something of that nature. But overall, their vital signs were good. They didn't, get severe rash. They didn't have a low blood pressure, or we call hypotension. So I think overall, as far as the severe reactions go, we've done very well. But we have just seen that consistent amount of initial reactions after the vaccine, again, which is mostly site reactions, some fever, maybe chills, maybe headache, all within that, 24 to 48 hours after the vaccine.
Yeah, and I think those are the things we're watching. Everything you just outlined are the things we watch for those 15 minutes. Alan, have you guys had much trouble in the county?
We haven't. We've done about 2,500 now. We've got a whole giant room with all these spaced out chairs where we watch people for our protocol's either 15 or 30 minutes. If somebody reports a history of significant allergies or ever having used an EpiPen previously, we keep them around for 30 minutes and monitor them. And then we've got a nursing staff that can, but we just haven't seen things either. I think very similar experience to what the health system has seen.
Yeah, so together we've done around 10,000 doses, and we're just not seeing terrible things, folks. This is safe. And, we have covenanted with you that we're going to keep telling the truth, right? That's our job. We're going to tell you all what we really have going on, and we're not seeing it. That's the truth. Vaccines, Pfizer, Moderna, safe. COVID, not safe. Next question.
Hi, this is Ellen McNamara from KCTV5.
Hey.
Hi. Okay. So we have been talking to some older people in the community, ladies who play bridge, older people who live at home, but they're active, they want to get out into the community. And they're frustrated because they're seeing their older friends, their older family members in places like Florida, California, Arizona, even like Pennsylvania, New York. Some of them are starting to make appointments and they're starting to get their first dose. And we've talked so much, this week y'all have, and last week about supply. Are we kind of like flyover country right now? I mean, with the supply chain, what, in your opinion, is it just supply based on population that's the problem? Like, what would you tell to some of these older folks who are just frustrated that they just want the shot and we are not Arizona having these big clinics set up just yet?
Yeah, so here's I'm going to turn to all of our experts around this because this is the hard question of the day. Thank you for asking it, though. The truth is we have clinics set up. We're ready to go, Alan Greiner. We could be doing thousands of people a day. We could do 2,000 people a day here at this health system. I know Wyandotte County can do thousands a day. I know Johnson County can do thousands a day. Got to get the vaccination in, though. We got to get the vaccine here. What's different, Alan, between here and Florida or here in Texas, where I know patients are getting the vaccine?
I'm not 100% sure we know. Ellen, you may be right. It may have a lot to do with just total population. We know the allocation, was set up so that depending on your state total population, that's kind of what you got as your initial bolus. I do think our state tried pretty hard to push vaccine out to very small rural hospitals, my sense is they did a good job. I've been talking to a lot of rural docs in the last few weeks, and they did a pretty good job, which I think is valuable. And those rural populations are very elderly as well. Other states may not have done that. So if they got a bolus in a huge state like Florida, they might not have done as much outreach to certain geographic areas, and then they might end up with some extra, for example, in Miami. I don't know all the details, but I hope we get this changed in a week or two. Again, we've got our website set up to where people can go in there and register. We want them registered because as soon as they're registered and we can all start rolling through thousands a day, it's not going to take us long to get the people that want it, that are in those highest age groups and have the highest risk factors.
Alan, I'm going to take another swing at this, and then I want to talk to Jason a little bit about some of the inequities that this could perpetuate. But, one of the challenges is that when 60% of those you offer the dose to take it, but that means 35 or 40% of people are turning it down. So if you have a county or a place with a large population, you're going to have more turned down doses, and you're going to have to figure out what to do with them. I know that in Western Kansas, the uptake rate is closer to 50%. And so they've done a little bit of patient vaccination out there, or so we're told. And I think it's because there's extra doses sitting there unused. And we don't want it to be unused. Here we've got a large volume of healthcare workers and a large volume of first responders, et cetera. So when we have people in a health system or in the community turning it down, well, we just go to the next person in line. So we have a lot of people we still have to distribute it to, because there is a large focus of healthcare workers in our area, because we have a lot of advanced healthcare facilities here. So that makes a difference, and I think that's part of what people are feeling a little bit. And I think the key is that 35 or 40% are turning it down and how states handle it. The second thing is that many states aren't following the CDC guidelines. So they've said, okay, we're going to do first in line healthcare workers, but the rest of you who work in healthcare, we're going to treat you like patients. So now we're just going to shift gears and go to those over 65. So they've taken the guidelines from the CDC and they've just not followed, which is, honestly, that's been told that was okay. So, Dr. Glenn, other thoughts that you have? How is this going to make our fears about health inequities around vaccination worse?
Well, our biggest fear in planning is that privileged folks would get the vaccine, and that, poor people, particularly poor people of color, would be, left behind. And that's how we've, really tried to mitigate against that in every way we can, and looking at what the federal guidelines are, what the KDHE guidelines are, how can we stratify our programming for vaccine distribution in a way that tries to take care of that. And for Wyandotte County, when you go on their website and fill out your interest in getting the vaccine, we've asked for information that can help us prioritize those at-risk communities. But the other half of that, right, so capacity-wise and what our counties are doing, we're trying to be ready to get to our most vulnerable populations. But we have to have the information campaign to go along with that, such that people who are most vulnerable, we can alleviate some of their fears about mistrust. And if we don't do that, then we're going to fail.
Yeah. Mayor, any other thoughts around that?
So to that point, I think our health department, I think, received a grant or through CARES Act funding. We're going to be able to expend quite a bit of funds to reach out and to get to all the population in Wyandotte County. And so that's going to be an important effort as we continue to roll out the vaccine in Wyandotte County.
Next, any other reporter questions today? All right, I'm not hearing any. So, Jill, I bet there's some questions out there in the community.
Yes, there are. And reporters, if you think of one, just send me a text. Okay, Mary wants to know, how does a health department determine whether a particular bar or restaurant is a source of spread?
Oh, great one. All right, Dr. Greiner.
Yeah.
That's a great question, Mary. We have a whole team of epidemiologists and contact tracers. You've probably heard a lot over the course of the pandemic about contact tracing. They're doing work every day, 7 days a week, trying to talk to cases. And they sit and talk to cases for hours and hours to figure out where people who've come back with a positive test have been in the prior days and weeks. We've found over the course of the pandemic that information can be pretty darn reliable. So we tend to figure out if even a family party of 3 households of 15 extended family members was together, and we can connect cases and the timing seems appropriate, then we think, okay, it's very, very likely that's where spread occurred. So we can often do that in a situation like a bar or restaurant too. And there's been a lot of that kind of stuff published in the international medical literature as well. It's not 100% foolproof, but it's very helpful for identifying employment situations or businesses where that might be happening, or if, family gatherings or things like bars and restaurants. So that's how it happens.
A different Mary wants to know, how do 90-year-olds with medical issues who don't live in a nursing home get the vaccine?
That's a great question. Okay, Greiner, you're busy this morning, man.
Well, that's one where we want to identify those people as quickly as we can. Different counties are doing slightly different things to identify those people, though. We hope, again, if the supply starts coming in and we're allowed to move beyond healthcare providers by the state, we think that's going to happen within weeks. So I think, and I've certainly had lots of patients talking to me about this, I think it's reasonable to talk to your healthcare provider and put a question out there. If you live in Wyandotte County or Jackson County, both of those counties do have website interest forms ready to go. So I've mentioned that. You can go to the website, look up the COVID info, look up the vaccine info, and you'll find those registrations. I hope that Johnson does it soon and other counties, because that way you're on a list to be contacted and they'll get you scheduled and in. We hope that our health system will be able to do something similar in the coming weeks as well.
We're gearing up for that, and we also have My Chart to notify our patients when they're up, and so we'll be doing that, and I assume that we'll be allowed to do, one of the problems is we don't quite know the plan altogether in Kansas, but I think it'll focus around the public health departments, and that's really important. And fortunately, Wyandotte and Johnson County both have strong public health departments. You get out into some areas of Kansas, the public health departments can be really small, so we're going to have other alternatives. I think the CVS Walgreens part will be a solution. We heard Dr. Norman address that on Monday, and I think the health hospitals and health systems out in all parts of our state will be important. And I think the same thing is true in Missouri. So, I think that we just have to keep on working.
Kitty wants to know, how do I get a shot if I don't have a primary care physician and I don't have insurance?
You bet. Well, one thing we do know is that vaccines are free. And, even here at the health system, we're not charging an administration fee, and we're not charging for the vaccine either. And that's been our approach as we've vaccinated people. But, Alan, I don't think you care whether somebody has a doctor. You can sign up on your website.
Yeah, we hope that all public health departments will do that service for patients like this. We're certainly going to do that in Wyandotte County. We're going to try to figure out how to use any stimulus money that comes down the pike to take care of the administration fee, because the vaccine is free. So we'll have a system in Wyandotte. If you're not in Wyandotte but you're in another county, contact your public health department. They'll be your best source to get vaccinated.
Jason, this has got to be part of the healthcare inequities we've been addressing. If people can't afford to get a vaccine or have travel to get to the vaccine, they're going to be at a disadvantage.
They certainly will be. There are mobile units for some county health departments that will try to go out to more remote locations, and then also trying to utilize your CVS and Walgreens networks. But this is something that we're actively working on to try to make vaccine distribution as local as possible. The challenge with that, of course, is for the Pfizer vaccine is whether or not they have storage capacity. Those very cold freezers that vaccine necessitates. The Moderna vaccine, much easier to distribute, much easier to handle. But these are all logistics that we're really trying to work on. And that's why it's important that, one, we get the outreach out and that people who are interested really go on, fill out those forms so we have a sense of, not just your qualifications, but where you are and, how we're going to get to you.
Hawkeye, one of the things we should say is there's still a timeline for Johnson & Johnson and for AstraZeneca. Johnson & Johnson and AstraZeneca, it sounds like one may be available in March and one may be April. Those are game-changing events because they're a different kind of vaccine, but they're much easier to distribute.
Yeah, absolutely. And that's why, I've been telling people, I think there's really the three ways that you can go about to really, if you want to get the vaccine. And that's number one, your local health department, whether that's the city or the county. Number two, that is your medical care team. If you don't have a medical care team, hopefully there will be other clinics that you could just walk into and set up an account and become, everybody needs a primary care doctor. And then the third is going to be those commercial entities that you talked about. So I think with those other smaller clinics, if they're not part of a larger health system, or those clinical entities, those commercial entities like the pharmacies, those Johnson & Johnson, AstraZeneca, if they are approved, do look to be the game changers because just what we heard our guest talking about, the storage capacity, the ability to hold those doses either in a regular refrigerator at regular cold temperatures or at room temperature for an extended period of time. That is the way that we are going to get most of those doses out to the mass public. And so I think that will be great.
I think we have to remember that one of the troubles with this the pandemic is that we've had to build the airplane while we've flown it, and at times we didn't have enough parts. If you remember the beginning of this crisis, we didn't have enough PPE. We were getting cloth masks inside hospitals because we didn't have enough masks for patients. We didn't have gowns for people. Then we had a shortage of ventilators across the country. And then we had a shortage of ICU medicine to keep you comfortable on a ventilator. Then there was a shortage of this and a shortage of that, and now the shortages of vaccines. In a few months, I don't think we're going to have a shortage of vaccines. We have to get through the next 2 months when I think both Moderna and Pfizer have been ramped up. This pushing us into March and April, and at that point, if we get Johnson & Johnson and AstraZeneca, we're going to have a lot of vaccine, and that's going to be good. What can you do to stay safe until the meantime? Remember that the rules of infection prevention and control keep you safe, just as we've proven 1,000 times over. Actually 2,000 times over, because we've had over 2,000 patients in our health system with COVID-19. Just as we've proven right here by keeping our staff safe, by wearing a mask and washing their hands and taking care of over 2,000 COVID patients. You can stay safe while you await the vaccine. You've been doing that for 10 months. 2 more months. 2 more months. We can get this done. Next question.
Kathy says, what if I don't have internet? How do I get a shot?
Yeah, well, I meant to ask that question. Okay, Alan, how are you going to get to people who don't have internet? You're muted there.
We've got a 311 line in Wyandotte. A lot of counties have one of these 311 lines that has information on all their governmental services. Our operators are aware that some people don't have internet or computers, so they can actually take your information down over the phone and populate it into that registration vaccine interest form.
Okay, awesome. And is it? I think it's bilingual.
It is bilingual. Yep.
Okay, great.
We do have some people that are apparently have been in our system before, the health system, that are patients. And I think if we broaden the question, it might be germane. I know we can only speak for ourselves, but if you've had some encounter with a specialist here at some point in your life, are they going to be eligible to get their shot from here?
Yeah, that's a great question. And to be honest with you, I think we and every health care system around our area and around the country are trying to wrestle with that very question. And here's what I would tell you. We're going to try and follow the best infection prevention control that we can, so the best rules, meaning that over 65 first and then different disease categories. But we're trying to reach out to all of our patients. What I don't know yet, and what's going to be the limiting factor, is the amount of vaccine. And that's why I would encourage you to stay abreast of where all the vaccine sites are, and they're going to be, right? Again, health systems, health departments, Walgreens, and CVS. Yep. That's the distribution network that we're seeing right now developing across the country. So make sure you stay in touch with all of those vaccine networks or try to know where they are. How many people will we be able to reach out to from our health system? I don't know, because I don't know how many doses of vaccine we're going to have. And so we're going to turn to the most vulnerable that we can see, and we can try and determine in a reasonable fashion. Until we get so much vaccine, we can just open it up. And once we get enough vaccine, we'll be happy to open it up. We just got to have enough vaccine first. And that's what we talked about before. Mayor, that's what you got to feel is the rate limiting step in the county.
There you go.
And I bet, Jason, historically, when we tried to look at this thing of supply and demand, oftentimes people were disenfranchised on the basis of income or certainly on race. Hopefully, we're seeing a change in that right now. We're trying not to disenfranchise everybody and make sure that everybody can get a vaccine.
Yes, we are. And that is our goal. We want to get the most vulnerable folks. We want to get the folks who are most vulnerable to die from the disease if they get it. And that is what the folks at the county health department are really committed to. It's a good group of folks who really want to get this right.
Jill.
All right, Melissa said she had COVID recently. Mm-hmm. She believes that it's rare that she could get COVID again within 90 days, true or false. She says that she also believes it's rare that I can give it to someone else if I get it in 90 days. And she doesn't know whether she should get the vaccine.
Okay, Hawkeye.
Okay. I would say true. It's probably rare to infrequent that you can get it within 90 days after you've had COVID-19. Is it true that you can't spread it? I don't think we know the full data for that. We know that, in the published studies, some people have had less symptoms or been asymptomatic, and some people have had more symptoms. So it's really unclear right now. That is one of the questions that is not answered. you probably will still have some replication of the virus in that second infection, even within 90 days. Will it be to the amount that you can spread it? I just don't think we know that. So, and what was the last question?
Should she get the vaccine, or should she wait?
No, we are actually recommending that people who've had COVID-19 get the vaccine. There is no minimum time between getting COVID-19 and getting the vaccination. We do recommend that you don't get the vaccine while you're acutely ill, so you really have to be outside of that 10-day isolation period. Initially, when we were giving vaccination here at the health system, we had people wait for 6 or 8 weeks just so that we could vaccinate people who don't have any immunity compared to the people who've had the disease and got some partial immunity. But right now, if you've had COVID-19, it is certainly recommended that you do get the vaccine.
All right. Heather wants to know, will the vaccine help prevent long haul syndrome?
Well, that's a great question, and I think we don't really know the full answer to that, Hawkeye, but I think we're pretty hopeful, because if you don't get serious disease, you tend not to get long haul syndrome.
I think that's the key there. We know that you can protect against disease and severe disease, so without those entities, you can hopefully be protected from long haul syndrome, especially those significant ones like the cough, the shortness of breath. We know that people, even with mild symptoms, can continue to have headache or things of that nature. So you may still get a little bit of symptoms or a few symptoms, but hopefully not to the extent and intensity that you would if you otherwise got the disease without having the vaccine.
All right, Jill, the hardest question now is to ask you to come up with a final question.
Yeah, well, I'm going to go to Anil, because he's just he's such a good, faithful, and hard-working patient. He's trying to, and he actually is asking a question that several people are asking, but it's a crystal ball question. When are kids going to be added to the vaccine rules, and do we foresee a time when children will have to have this vaccine added to their back-to-school routine?
What do you think, Alan Greiner?
Great question. You know, we know the Pfizer vaccine can be given to 16-year-olds and up, and the Moderna's 18 and up. We've got trials starting. In fact, I believe Children's Mercy here in town, and possibly even our health system, will be involved in some clinical trials of the vaccines in children. We've got to get those trials going, and we've got to get them to the same point we got to with the Pfizer and Moderna vaccines before we'll start with kids. So it's going to be some months for sure before we start with kids. Whether it becomes part of a routine thing for schools, I don't think we know, but I think it's possible. It's certainly possible that vaccination for COVID becomes an annual or some sort of routine scheduled thing, and that it's encouraged or part of something required. Again, Dr. Glenn and the sort of ethics and history of this will be key to us deciding how much we require versus how much we consider voluntary. Those are tough decisions that we'll have to make in the future.
Yeah, really important, I think. Any other comments, Hawk?
No, I think Alan hit it right on the head.
Hey, tomorrow, Dr. Greg Pollan is a physician scientist and a founding member and the current director of the Mayo Clinic's Vaccine Research Group. He'll be back on our program with us. That'll be a great program because he was with us before. He is just really well informed in this area, so we look forward to having him back. He is also the editor-in-chief for the journal Vaccine, and his work continues around the development of vaccines, emerging public health crises around infection control, so it'll be a really special program. I'd like to turn back to our guests today to ask them to leave us with their final thoughts. Jason, I'm going to come to you first.
Well, my final thought is, I hope that in our efforts we can continue to target those who are most vulnerable. There are, political pressures we face, and, just continue to do the right thing toward the people who need us most. And that's what I hope we continue to be able to do.
Thank you. And thank you, Dr. Glenn, for being on the program and the great work you do, trying to help us look at health justice, such an important field, and some of us feel like that's like one of the most important works of our lives. So, Dr. Greiner.
I like to reiterate, do the right thing. I think despite all the political craziness we've seen in the world in the last couple of weeks, we've got to rise above that and keep working together. There's tough decisions around this because there's so many unknowns all the time. But we have seen, as you guys always preach, infection control is key. Now we're getting into vaccines, but we've got to do the right thing and work together and have some teamwork on this to get through it quickly. So hopefully we can do that in weeks and months, and we'll be golden.
Yeah, and right there with you. Mayor Alvey.
I would just encourage everyone to continue to look at your own personal responsibility in this pandemic. If we would all start there and reflect upon what is the virus, how does it move, what can I do to prevent myself getting the virus, spreading it to others. If we would simply commit to neither get nor give the virus, we would come out of this much more quickly and return to normal.
Yeah, thank you. And thanks to all three of you all. You guys just have done such great work in our county, and we just have to be proud to be part of Wyandotte County because it's really led the way in trying to be honest and truthful and getting to folks and treating everybody the right way. I mean, it's just, thank you, and thanks for the great work you've done. Hawkeye?
Yeah, I'd like to just piggyback on all of our guests. I think, their comments were so great. The first thing is we continue to take pride and want to give everybody the truth. And this includes, our patients to everybody in Wyandotte County, everybody around the metro, especially in those minorities, in those groups that are disenfranchised and have been and have undergone, we've heard Dr. Glenn talk about. And whether it's socioeconomic or living situation or anything like that, those are the most vulnerable populations. So getting the vaccine out to those populations is vitally important. The next thing is Wyandotte County is in very good hands. We know that Mayor Alvey and Dr. Greiner, I think Wyandotte County in general has been a little bit more conservative and stringent in some of their restrictions over the course of the pandemic. So please understand that that's where they're coming from. They are looking out for the health of Wyandotte County, and thank you all for what you do.
Yeah, another big thank you. The arc of history bends towards justice. Sometimes it goes off course a little, but it can stay on course when we tell the truth, when we can do right by each other, and we make sure that our priorities are things we live every day. The rules we follow: save the patient, do the right thing, be the bridge, ask questions, seek answers, and those who laugh last. Those are the rules that will get us through a pandemic. Let's follow them. We're back with you tomorrow.